Ladies and gentlemen, I am Professor Dr. Mohammed Iqbal Khan Adil. I am Fellow of the Royal College of Surgeons of Edinburgh, United Kingdom, and Fellow of the Royal College of Surgeons of Ireland, which I qualified in 1995. I had my full training as a Fellow of the two Royal Colleges in the United Kingdom, and I made extraordinary achievements in advancing my training not only in general surgery but also in minimal invasive surgery, which is the requirement of the modern surgical techniques. That includes robotic, laparoscopic, and the endoscopic surgery. Laparoscopic surgery came into action in 1990 when I was working as a SHO in the Royal Infirmary of Edinburgh when we started doing the laparoscopic gallbladder surgery. So, in other words, I am one of the pioneer of the laparoscopic surgery, started over 35 years ago. With the laparoscopic way, the small cuts are made into the abdominal or thoracic cavity through which the various pores are introduced along with camera, and the abdominal or the thoracic cavity is insufflated with the moist carbon dioxide, and the other instruments are introduced from the other ports, which includes the graspers and the dissectors. With the help of the camera, monitoring system, and the grasper and dissector, the abdominal organs which are required to be removed from the body are dissected very carefully and removed from the body cavity. That includes laparoscopic cholecystectomy, which takes hardly 45 to 60 minutes, laparoscopic appendicectomy, half an hour to 45 minutes, laparoscopic hernia repair, unilateral or bilateral, laparoscopic small and large bowel resection, right and left hemicolectomy, total colectomy, anterior dissections, laparoscopic liver resections, laparoscopic nephrectomies, and the splenectomies. So the benefit of laparoscopic surgery is there is a less trauma to the patient. The cuts are only half to 1 centimeter long, minimal bleeding, minimal pain, early discharge, and early return to work, and is cost effective. The robotic surgery started at least 10 years after the laparoscopic surgery was in full bloom. The first robotic surgical instruments introduced were the Da Vinci system. FDA in the United States in 2000 allowed the robotic instrument to be used in the human body to remove the diseased organs. The landmark and the milestone in the laparoscopic surgery was in 2001 when one of the renowned surgeons in the United States removed the gallbladder of a patient anesthetized in Strasbourg, France, within 1 hour. And after that, there was a major improvement in the laparoscopic surgery. and robotic surgery, and a lot of operations were performed with the laparoscope, and different laparoscopic instruments were introduced by the end of year 2010, and the three famous instruments in the robotic surgery are the systems which were used are the Da Vinci system, the intuitive robotic surgical system, and the Medtronic robotic surgical system, which is in practice in various parts of the world. The robotic arms, a table, and a console, and the monitor system with the 3D invention are all used in a specialized robotic theater where the specialized robotic table the patient is placed, and after general anesthesia, small cuts between half to 1 centimeter are made on the abdominal or thoracic cavity, and then the four robotic arms, which are connected with the cameras and the sensors and surgical instruments, are introduced into the body as per requirement for removing the particular parts of the diseased body. And this table and the robotic arms are connected with the computerized console held by a surgeon, either sitting in the same room or miles away from the theater. And with the slight movement, he can use his technique by looking at the console and on the monitor to the robotic arms, which are picked up by the sensors attached with the robotic arms with the very precise and tremor-free movement. Precise surgery is performed within no time, and the diseased organ is removed from the body. So this is the future of the surgery. I must tell you that the traditional surgery is going to die. It's the end of the traditional surgery, and the future is on the robotic and the laparoscopic surgery. The only difference is in that the laparoscopic surgery is cheaper, learning curve is short, and is easily available on various surgical centers, and shorter curve of learning. However, the the robotic surgery has longer a way of training and require very expensive and specialized surgical unit is required with the trained and the motivated staff. So therefore, it's not easy to implant the robotic system in every hospital. However, most of the hospitals in the world are practicing with the laparoscopic surgery. Even the juniors are trained with the laparoscopic way. And lastly is the endoscopic surgery, which all of us are familiar that with the gastroscope and the colonoscope, we can look into the uh, gullet or esophagus, into the stomach and the small bowel. And with the colonoscope, we can, uh, which is connected with the camera, and by looking at the monitor, we can look into the colon and take a biopsy and remove the polyps or other. I can investigate the bowel very easily. So these are the three different ways of minimal invasive surgery, which I wanted to bring to your attention for further information. So I am working in Pakistan nowadays, and I am trying to implement the minimal invasive surgery in Pakistan exactly at the level of the robotic and the and the endoscopic surgery performed in the United States, in UK, Ireland, and Europe. So I'm working in three different hospitals in Pakistan. I'm training my juniors and middle grades and my consultant colleagues. I'm working full time in Barry International Hospital from Monday to Saturday from 10 until 4 p.m. And then I'm working in a Shalimar University College Hospital 3 days a week. And also, I'm working in a Lahore Care Hospital another 3 days a week. So, my ambition is to train my juniors and to provide maximum benefit to my patients and to advance the surgical techniques in Pakistan. So, anybody who want to get the benefit of such training and the surgical procedures in a very short time can travel to Pakistan, and I'm here to help you out. Many thanks. All the best. Bye for now.